Welcome to our 5 on 5. Pleased to be joined by Congressman Greg Walden. Congressman, good to see you, sir.
Good to be with you.
Thanks for being here. You just participated in a coronavirus roundtable at the White House this week, I believe. Today you met with Jackson County and Josephine County Public Health. We're recording this on Saturday. I want to make people know that as things change. It's airing Monday. On a scale of 1 to 10, how concerned should people be about coronavirus?
You know, I think they need to be concerned, but thoughtfully concerned. This is spreading. But if you think about the hundreds of thousands of cases of flu that are in the United States, the 14,000 people who have died of the seasonal flu, we need to keep this in perspective. Now, the difference is it's a new virus. We do not have a vaccine for it. We do not have a treatment for it. That's why we have to be very vigilant, because having neither of those means we must rely on basic public health to deal with this. And so they're repurposing some drugs to try and see if the repurposed drugs will help treat this specific virus. We're going at light speed to develop a vaccine, but the soonest it would be available is 12 to 14 months if everything goes well. So that gets back to basic health. You need to wash your hands. You need to use this sort of thing.
Especially people who shake hands and travel in airports.
But all of us need to do it. And by the way, that has the side benefit of helping reduce the spread of other infectious diseases, colds, other flu bugs, will help all around. We just got to be smart about it. But people should remain calm, go about their lives. The masks, there's a lot about, should I rush out and buy every mask on the
they're
shelf?
going off the store shelves now.
That's probably unnecessary, I would say, and the public health officials would agree. If you have a cold or something, you want to slow the spread of that, sure, because you're getting droplets that don't go away. But the high-end masks need to be available for our healthcare professionals who are every day working in close quarters with people who are sick. And there is a limited supply because most of these masks are made in China. And guess what? With the huge outbreak there, they have consumed all these masks, or not all. We do have stockpiles available of drugs. We do have stockpiles available of masks. We work closely with the state and local healthcare officials, and we can move supplies around if there is a serious issue and a serious shortage. But you don't want to do that unless you have to.
Okay, we have a lot of other issues I want to cover. We're going to take a quick break. Stay with us. Welcome back to our 5 on 5. Again, here with Congressman Greg Walden. Congressman, you announced in the fall that you were going to seek re-election. Correct. Has that changed anything about the way you're governing right now, or is it freeing you up?
No, well, I don't have to raise money and run a campaign, but no, it hasn't changed anything. Look, I had a great journey in public service. I'm very thankful to the voters for giving me that opportunity to go stand up for them and try and bring people together and solve problems. And I'm not one of them leaving the Congress cranky and grumpy. Democracy was made to be messy and loud. It is, and sometimes we'll all admit it's a little messier than we'd like, but it still works. And most of us have a common goal of solving problems, and it's been a great run. And I go out on really positive about where we're at, not diminishing the problems we face or the need to face these challenges head on. We got a lot of work to do, and I intend to run through the tape and get as much done as I can.
Late last year, you introduced the Lower Costs, More Cures Act of 2019 to lower drug prices. Right. Where is this bill today, and how would it lower prices for consumers?
Well, a couple of its provisions actually found their way into other laws and are now into law. One of them, the CREATES Act, would stop a practice by the pharmaceutical companies of denying samples to generic manufacturers to slow competition. We put a stop to that with the CREATES Act. It's now signed into law by the president. There was another one about pay to delay, where they would basically buy out competing product or slow down that process so the drug couldn't get into market. We're putting a stop to that. What we're trying to avoid is this, I think, a bad trade-off that you go down a path of having the government step in the middle and deny Americans access to revolutionary new medicines by having these price controls put in place. I'll give you an example of what I mean. There are 272 drugs in Canada, in the U.S., new medical drugs, that you can't get 52% of them in Canada. And when you look at foreign countries, part of what they do is they create a formulary, they deny access to the new drugs, and so their citizens are not getting access to the new medicines that we get access to. Our problem is we get those drugs, but they're ghastly expensive. And so we've got to figure out a way to bring down the cost of drugs without diminishing innovation. As we talked in the first segment about the coronavirus,
sure,
we want innovation. Guess what? Nearly all of it occurs in the United States. The balance we got to get here is we're paying for that too as U.S. citizens, and foreigners aren't paying their fair share. So there are issues we're trying to work through where we don't diminish access to the innovative new drugs and what's out there in the future. The alternative bill that passed the House on a just about total party line vote, the nonpartisan Congressional Budget Office said that it would result in 8 to 15 new drugs never coming to market because you'd see a reduction in investment. And that's just in the first 10 years, be far more than that in the second 10. So I want to be careful about not denying access to new drugs, not diminishing innovation, because we see right here and now the importance of having these innovators going to work right away to find cures and vaccines, and we need it for antibiotics, and so we're trying to strike that balance.
We're running out of time, but I do want to ask you about surprise medical billing. Yep. This is something you're focusing on. What's being done? So.
Well, we have a bipartisan bill there. The chairman of the Energy and Commerce Committee, Frank Pallone, and I have been shoulder to shoulder throughout. Consumers are getting ripped off. I'll tell you, we must be onto something because the big Wall Street private equity guys have spent nearly $60 million in television ads attacking us and what we want to do to take the consumer out of the middle. We've been working with Patty Murray out of Washington State and Lamar Alexander, Senator out of Tennessee. 4 of us together are locked. The other committees have jurisdiction or playing in. We hope to have something done by May. We passed out of our committee unanimously, and so we're trying to get it done. Look, if you play by the rules in America, you follow all the things in your insurance policy. When you go to the hospital, you shouldn't get stuck with a surprise medical bill, which, by the way, means nobody covers it and you get it fully. Sanji Wilkes in Colorado went in, delivers her second child, thought everything was covered, doctor, hospital. Child had a real serious issue. They said, we got to take him to our neonatal intensive care unit 50 feet down the hall. That hospital had contracted out that neonatal intensive care unit to a third-party provider not covered by her insurance. Now, how the heck would she know? That's wrong. That's what we're trying to stop.
Fascinating. Thank you for being here. Appreciate the time.
Yep.
All right. Stay with us.